Thanks. Right, shall we just move on to the next slide? So we were just going to speak to you about cover a couple of areas. We're going to talk about obviously a career in social work, tell you a bit about what's involved as a social worker, and just give you some insight into career development opportunities within the social work profession. So in terms of what do social workers do, I was actually going to ask Fahida and Trisha May what you think we did before we tell you what we did, seeing as you've got an interest, or even Chandu really, if you what do you think we do? But I won't ask Chandu because he probably does know. But Trisha May and Fahida, what do you think we do?
Do you go and visit people and talk to them?
Yeah, definitely. That's one of the main things we do. Anything else?
What impression you have from media or other places as well? What do you think social workers do?
Go to people's houses, see if they're okay.
Oh, you sound really low, Trisha. Sorry, I couldn't hear you.
Go to people's houses, see if they're okay. Then you talk to the people, young people, parents as well.
Yeah.
You're definitely saying all the right things. So there is a big element of the role which is about visiting people in their homes, communicating with people. And you said seeing about seeing if they're okay, checking on welfare. Welfare is really important. And I know that Fahida mentioned a couple of things in the chat. Should I admit?
It's all right. Don't worry. We'll sort it.
Okay. So Fahida was saying that aim to help and improve people's lives. Absolutely, that is a key part of our role. Hi, we've got someone that's just joined us.
Hi.
I think Paige needs to go in another room, Maz, the apprenticeship room.
Oh, right, this is the social work room.
Yeah.
How do I do that?
We'll just move you, don't worry. Yeah, we'll move you in a minute.
Okay, so Mamta, do you want to just carry on with this?
Yeah.
The slide? So yeah, some good things that Fahida's talked about, how they socialise, how we communicate with others, helping to improve lives. So in this slide, I'm just going to talk a little bit about what we do in adult social care, because we work with adults in our roles, and one of the main parts is about assessing social care needs. It is about supporting people to live independently in their communities and in their own homes. It's about working with people to improve the quality of their lives, and it's enabling people to achieve their full potential. So quite a few of those things about improving people's lives, as what Fahida said, is really important. But the skills involved in that, they go back to what Trisha May was saying around communicating, how we talk to people, how we interact with people. So some of the 4 main key functions of adult social work is around social care needs, so enabling people who may have certain disabilities or health issues and are not able to function as well in the home, but not about going in and taking over, but how we can actually keep people independent. Improve quality of life, what are the outcomes that people want to achieve so that they can continue to lead a productive and fulfilled life, and obviously what they need in order to achieve their full potential. Thanks, Mamta. So before who do social workers work with? Because I know that Trisha May, you were mentioning us going to people's house, and you mentioned young people. Do you have any other ideas about what groups of people that social workers might work with?
Young children.
Yes, yeah, young children. That's right. Any other groups particularly? What about adults?
Oh, yes, adults as well.
Yeah, yeah. So if I just, Mamta, if you want to go forward. So in adults, the adults group that we work with, they have particular needs. So we might have some people who will have mental health needs and support needs, or they might have a learning disability. They might have Down syndrome, they might have autism or Asperger's. We may have older people as well that might have particular health challenges or physical challenges. Those people with a physical disability. We may work with those adults who have substance misuse, abuse alcohol, or have drug dependency issues. And then we have the groups that actually in the family that care for them. So it's not just those people that have those needs, but in their family they may have relatives, spouse, partner, friends that actually providing that care. And as carers in the family, they also need support. So in the adults arena, those would be the people that we worked with. And yeah, you've pointed out, Fahida, about physical disabilities. And then also, Tricia May, you mentioned in children's, we do work with children's, and some of the groups that we work with are fostering and adoption, children's child protection, where we've got children in need, and also other groups such as leaving care. Sorry, Mamta, if you want to just click forward. Care leavers, looked after children, people in care, youth offenders, and then we also have young carers as well. So they might be looking after someone in their family. They might be providing care for a sibling that has needs, or even their parents might have needs as well. So those are the groups of social workers that that we would work with. So I just wanted to ask Fahida and Tricia May whether you had any questions about those so far, anything that I've said before we move on, anything you'd like to clarify? Does that make sense?
Yes, it does make sense.
Okay. Chandu, you're all right with that? Okay. Thanks, Mamta.
Okay. Okay, so just taking over from Berylin, why a career in social work? So why you want to consider it, or?
Yeah, you can use the chat as well if you don't feel confident to speak.
Yeah, sure, please use chat, but I'm unable to read the chat. I have to go into those.
Don't worry, I can see the chat. I can help as well.
Yeah, I'll see the chat as well, Mamta.
Okay. No worries.
So putting you a bit on the spot then, Tricia May and Fahida, why, even if it's not for yourself, because obviously you're finding out information, why do you think people choose to go into social work? Kwesi's typing, so I hope you're contributing, Kwesi.
Are you all still there?
Yeah, I was waiting to see what came up in the chat, and maybe you're reflecting. I'm just interested to know from Fahida and Tricia, whether what made you come into this room? Hope you didn't come in by error and it's not because you just couldn't get back out. I hope it's because you were interested. Is it just about finding out more information? Kwesi saying Kwesi's says you're reflecting, I'm reflecting. So Tricia says, I'd like to be a social worker, so when young people have trouble at their house, I can talk to them. And that's very, very important and significant, particularly in the climate that we are in at the moment. That's really great.
So that's the most relevant answer if you really want to help someone, or it's just a very rewarding job, and it's full of challenges as well, but very rewarding at the end, that you will see it, you can make difference in people's life. So that's why if you're thinking to make difference in people's life, this is the right job for you. And if I'll move to the next one.
And Zahida's just said, Mamta, this is about, she's mentioned about she would want to make a difference in someone's life, whether it's in their mental or emotional state of mind. So she literally just said what you said as well. Thanks for that, Zahida. Thank you, Trisha.
Thank you, Zahida.
And it's just one point that Quest is making. You said that you're reflecting, and that is very significant for our profession, because as social workers, being a reflective practitioner is a very key skill in social work. So I'm just putting that back to you. So if you're already reflecting, you're in the right room.
Yeah, because that's a skill we want people to have, whoever is considering social worker job, because you continuously learn from your experience, continuously learn from your interventions you're providing to different people in who are receiving your services or intervention. So you always learn. Every case is different. Every person is different. Their circumstances are different. Their issues are different. So you need to pause and reflect that what I can do differently if I will have similar situation next time, what I have learned from this particular case, how can I implement or improve my experience and knowledge from particular case and do better next time. So it's always reflection, and whether you have, is there something your personal values impacting on your survey. So yeah, means reflection is a key for social workers. So definitely all the points mentioned by you are very relevant. So social workers in adult social care. So we deal with lots of issues in the community, in the family, with the individual person. It could be related to issues like social isolation. People might be living alone in their home, or even if living with other people, other family members might be very busy with their own personal commitments. So yeah, social isolation. We also work with people who have disability or health issues, any mental health needs, or sometimes people neglect themselves, maybe because of lack of motivation, or sometimes they might be at risk of harm, maybe because of self-neglect, or could be from other people. So we all do work with them. As a social worker, you work with them. Hoarding, again, some people might hoard some things they are attached to, but it might go up to a level where it can cause harm to them. So we work with people who are hoarding, or sometimes people who are homeless and they need intervention from us. And also, as Berylin mentioned before, substance misuse, maybe alcohol dependency, drug dependency. So we work with them. Okay.
Sorry, and could you put forward your slides? Because I don't think it moved on. It's still on YS career and social worker.
I have on my screen, it's showing. Social. So it might be slow server.
I can see why.
It's still the same work for me.
We've still got the same why career in social work. Okay, yeah, it's moved on now.
Okay. Okay, so and while we provide these intervention to people with diverse needs, we help towards assisting them to improve their self-care, support them in the home with their daily living, independent living skills. It could be via some assertive technologies, or by providing them maybe support from someone who can work with them to regain their strengths, and also identifying social groups, training or education or supported employment for people with different needs. It could be like elderly person living alone and wants to socialize with other people, so we can signpost them to the different community groups. It could be training for a young person who might have some health and social care needs. We can help them to go into employment with some support, and also different training or education they want to do. And also we have supported living. We prepare people to go into move into independence. So we support them with the different interventions, and these are a few of them. And these could be outcomes for some people, but every person have different outcomes they want from us or from our intervention. Okay, so as a social worker, sorry, I should not have opened this one, but just again, question, as a social worker, you will work with a lot of different professionals. Can you name a few? Think about some you think you might work with them as a social worker. I've disclosed one answer.
Yeah, you have. So is this about who we might work with, Mamta, as professionals?
Yeah. So it's multidisciplinary team. We have multidisciplinary teams. So one customer, or in some places we call that people with living experience. So different names, different local authorities, different services used. So in Newham we call them customers. So a customer might have different professionals working with them. So for example, someone with mental health need, they might have psychiatrists working with them. And there could be a customer where police is involved, maybe because of safeguarding reason or any other reason, or we might have to include them in our intervention. Then occupational therapists to do assessment to the customers to make them independent with the right equipment. For example, if someone with walking difficulties can have Zimmer frame they can use, or different things. Means there are lots of different equipment that occupational therapists assess people for, and then they can signpost them to the right things. Also, GPs, so very important part, we get information from GPs for developing a safer intervention plan for our customers. Substance misuse team. Then we have housing as well. You might have get these names or clues from when I mentioned what type of customers or what type of interventions we do. We said homelessness or people with substance misuse. So that's where we work with all those departments and officers from that area here. And community psychiatric nurses, community nurse, and sometimes probation as well, if probation is involved with the yeah. So any question about this?
So Kwesi said in the comment, I think a career in social care is a brilliant choice and is very important. I work in NHS and I'm responsible for digital tools that will help social work teams and NHS help people in an easier way. So that's about that collaborative working with our health colleagues, the NHS, the GP. That's a very essential part of our social work profession. So even though we have our own disciplines, it's that importance of partnership working. We don't work in isolation from each other. It's so important that we work together, because when we're working with a customer, as Mamta has highlighted, we're not as social workers the only ones that are working with that person. So we can't just be going in and doing our own assessment and intervention without liaising with other professionals that are also involved, like the GP. Fundamentally, a lot of people go to the GP more than they go to social care. So that's a important resource that for us as professionals we must have a good relationship with.
Yeah. Thank you. And similar way in hospitals as well. Sometimes we need to assess people before they are discharged to the community because of the risk involved, and they can't be discharged without having some sort of support from social care. So this is where we work with hospital staff members as well from the ward. Yep. Thank you. Any other question before I move to the next slide?
So is that Fahida, Trisha May, anything you want to ask? I know it's quite very removed from sixth form life, a lot of this, what we're talking about, but I guess we just want to give you the realities of the profession. Sometimes you might not get a good picture of it because we hear what the media says or hear snippets here, but we just want to give you some kind of real insight into what it's about. Yeah. Thank you, Mamta.
So next slide to you.
Okay, so I've got someone waiting in the lobby. I don't know if I'm just going to...
Yeah, don't worry, we'll sort that out.
Yeah, I'll just press... Yeah. Okay, so obviously, like any other profession, you're probably interested in, how will you be remunerated for all the skills and your knowledge and experience. So this is just to give you a bit of insight into the pay scales for our social work profession and career grade. They are slightly out of date because I think we presented this a couple of years ago, so they might not be current. And obviously, we've had a new budget as well, so who knows, it might actually get 1% increase on top of this. So you start as a newly qualified social worker. We'll tell you about the routes into social work afterwards. So as a qualified social worker, you newly qualified, experienced social worker. Sorry, Mamta, do you want to click the next slide so that I have the sketch? That's right. So you can see the starting range is about £32,000 for social work, and then career grade you can move up to a more senior role in terms of senior social worker or senior practitioner. Then practice manager, which is like a deputy for a team. Then you have a team manager. So that's around 50,000 if you're a team manager managing a team of social workers. Then you move up to service manager, head of service. I think it is probably more from about 60 to 80,000 for a service manager. A head of service potentially 100,000. And if you're a director, you get the big, scale of 150,000, and then you could become the chief exec of the council, and that could be up to 200,000. So what this shows us is that, obviously when you come into the profession, starting point, it might not necessarily be when you're looking at other professions, although maybe the starting salary might not necessarily be very high compared to some of the other industries, but your earning potential in terms of your career progression, depending on how far you want to move up and move into management and move into strategic senior management, there is an opportunity to have a good pay and good salary and have a good life in terms of your career choice through social work. And it opens up to other things, because chief executive is not a social worker, but it can be. I think we've had a chief exec in the council that came from a social work background. We've had directors of adult social care that obviously would have come from social work background, but not necessarily. So it does open other opportunities. And what I've just shown you here is if you were to go through the council, what opportunity you'd have to progress.
And can I just add as well, you get retention allowance as well. In Newham, it's 3,000 on top of your annual salary.
So Mamta's going to tell you how you get into social work. What is the actual routine, and what do you need to do academically to get into social work?
Thank you, Berylin. Yeah, so can you see my slides? Or it's still taking time?
Qualification routes?
Yeah, so there are many qualification routes. So as I don't know if you know or not, but a social worker is a restricted title. So you have to have qualification, relevant qualification, and this title you can only use if you're registered as a social worker with Social Worker England. So to go on to this route, you can have BA Honours degree in social work, or you can have master's, either degree or postgraduate diploma in social work. There are different routes to go into social work if you don't have the honours degree or you have not done master's diploma. So this is a new one, social worker degree apprenticeship. So for degree, it started from September 2019, and lots of local authorities are using this as well to offer people route to social work. So you should have minimum qualification of GCSE A to C, which is now I think under new is 924, I think 924. Yeah. So you should have that, or foundation functional maths and English. Maths and English C is really essential for you to have, and this is 3 years program. And in Newham, for example, we have this program via Kingston University. So our social work apprentice attends degree in academic training from Kingston University. So this social work apprenticeship is mainly led by employers like us in Newham. We employ people, and it's a 3-year program. It's a salaried and paid degree. So you will get a salary. You will be on contract for 3 years, for example. It might vary from different local authorities to different local authorities and other agencies. But in Newham, it's a 3-year paid job and paid degree, and it's mainly focused on the job training. So you will be working you will be like your placement for 4 days, and 1 day you will have university day. Or there might be some bulk days when you go to uni to have your academic teaching. And after qualifying, after completing your degree apprenticeship, you will become a newly qualified social worker. Okay, and then we have Frontline Program. So Frontline Program is mainly in children's services, where it's a paid route, and for this you will need a minimum of 240 UCAS points, and again 5 GCSEs 9 to 4. And for this one, for Frontline Program, you need at least 2 to 1 undergraduate honors degree, or 2 to 2 any undergraduate degree, but as well as level 7 degree, or it could be a PG diploma, it could be PG certificate. So this is a Frontline Program mainly in the children's services, and this is again 2 years program. Yeah, so after completing this, you will qualify as a social worker, and you complete a fully funded MSc in advanced relationship based social work, and you practice with children and family. So you will, at the end, you will get an MSc degree. Yeah. And so this includes a 6-week summer institute program, where it will be like a residential one, where you will have academic delivery. You will have tutors delivering most of the academic work. And then in year 1, you'll be placed in local authority, like for example, Newham is part of this as well. And so you will have support from a placement social worker supervisor, plus you will have support from your tutor. And in year 2, you will qualify as a qualified social worker, and you will work towards your master's in advanced, the one I mentioned, advanced relationship based social work practice with children and families. Okay, and then we have another program called Think Ahead program. So Think Ahead is, again, it's focused on people who wants to go into mental health services. And this is for graduates, and or could be for people who wants to change their career later on in their life. And it's again a partnership between higher education institutions, NHS and local authorities. So they all are part of this program. And this is again paid program. You will get salary. Any expenses towards your qualification will be paid by your employer. And it's a fast track. And again, I think for 2022-23, there are around 120 posts or vacancies all in England. So yeah, this is another one if you want to do it. So it also has summer institute where you will have teaching for 4 weeks, and then year 1 you will be on the job training. So either with local authority, NHS or any other agency working. And then you will have and mainly in Think Ahead, you will have cohort of 4 or 6 people. So as a 4 or 6 people on the program will go to each local authority involved or NHS or any other placement place. Yeah, and in the end, you will get PG diploma in social work. And in year 2, you will again work as qualified social work to get your master's degree. But with the first year 1, you will get a diploma. Okay, and so basic eligibility remains same. So you need to have GCSE and degree at 2-1 level. And you don't need to have a particular experience in mental health. Okay. Then we will have other programs like, sorry, I didn't mention one, but there's another one, Step Up. And this is also in children's services. And it's the same, with the Step Up program, it's a 14 months program. And it's mainly focused on people who are highly skilled and all graduates already. Yeah, so you will need to 1 degree level or any subject area. You don't have to. And for any of these programs like Apprenticeship, Frontline, Think Ahead and Step Up, you don't need to have but you should not have degree in social work, because if you already have degree in social work, you can go with this to be honors degree in social work. So you're not eligible for any other program if you already have degree in social work. All right, so and then not only these, but we also have some specialist role. Once you are qualified social worker, you will register with Social Worker England, and you can go into different specialist area. That could be practice educator. So you could go into this course, and you could be a supervisor for a student social worker. You can offer placements to student social workers completing their program under honors degree or master's degree or any other program. Okay, so you will get that qualification. Mainly it's sponsored by your employer, but you can go privately as well. Then also you could be approved mental health practitioner, also called AMP. It specializes in mental health, where you will be doing assessments under Mental Health Act. You can become best interest assessor, where you will do assessment of people who might be deprived of their liberty under human rights. For example, there are some restrictions on what they can do to maintain their safety, and it's in their best interest to have certain restrictions in place. But for that, you need to have this qualification, best interest assessor. And then there are variety of management and leadership roles, as Balin has shown you in the previous slide as well. So yeah, these are some of the routes and some of the specialism you can go into. You can become dementia specialist, or you can go into learning disability and autistic services. You can go into mental health services. So there are so many roles within social work as well. Yeah, any question? I can't read chat or anything.
Sorry, I was saying that's really comprehensive. I was just looking to see if there's anything in the chat, or whether, again, Fahida or Trisha May had anything they wanted to clarify or for you to go back on.
I have put link at the last slide as well, if anyone wants to go in detail of eligibility criteria, when the program starts, and what are higher education institutions involved in delivering some of these programs. You can click the link and have a read your own time. Yeah, no question.
I think the good thing is that with social work, you know, it's something that you can revisit later on as well in life.
Yeah.
It might not necessarily be your first thought or first choice as a young person, but it's something definitely you can get back into. And as you rightly said, even if you want a change of career, you know, there's opportunities, you know, Chandu, just letting you know if you want to change as well. Yeah. As you're on the line, I thought I'd put it to you, you know, that we do have recruitment looking for people who might be have been in a different profession, who want to come into the profession as well. So it's not something you have to kind of like, sometimes maybe with other professions like medicine or have you, that, you know, you go in from your A levels, you have to make sure you've got all the sciences, all the maths, and then you go down a certain route through your degree. With social work, it might be you do some other things, you get some other life skills, you know, get experience elsewhere, work elsewhere, and then later on you might decide to come into social work. So it's good to know that you know, if you're not even thinking about doing your degree now, when you do specialise, you choose the degree that you want to specialise in, which is social work, and then you go down that route. So you might not have made up your mind now. You might go off and do a degree in history or sociology. Like myself, I did sociology, and it was then afterwards I did the masters in social work, and then I went into the profession. So, you know, there are options down the line to consider in your career and in your life. Yeah, and these are very rewarding you know, programs as well. And yeah, you will change it anytime. I did my first degree in psychology as well, and then I moved into social work master's degree program, and since then I'm working in social work. So you have variety of roles, and you have variety of programs as well to enter into this profession. Okay, so moving to the next one. Again, a question for you all, just to see, what do you think are the skills and values you need to become a social worker?
And this might be a question where when you will go into any degree program or any education program or applying for the job, they might ask you this question as well. Not ask you directly, but there will be question checking what skills you might have or what values you think are required in social worker job. So any reply for this? Is there any message? Or I did sociology too. Okay, thanks, Julia. So Julia is typing.
So just again, caring, yeah, it's really important.
Definitely. Any other pointers? Okay, so I'm mindful of the time as well, so I will.
Oh, so hang on, we've got a few in the chat. Empathy was a good one.
Yes.
As well. Yeah, plenty of empathy and compassion as well, has been said.
Honest. Yeah.
Yeah, being honest. Excellent.
Yeah.
Really good.
Excellent. Yeah, so these are some of the social worker values: integrity, social justice. You should be fighting for social justice, not fighting, but there are legal framework as well, but you work towards giving people justice. Integrity, maintaining professional boundaries, empathy, as you mentioned, discrimination, you're ready to challenge discrimination, and you should have respect to other people as well. So I have picked up this poster from British Social Worker, British Association of Social Worker as well. So yeah, these are our main values: social justice, human rights, and personal integrity. Any question?
We also had having patience in the chat, which is a nice one.
Yeah.
Yeah.
Definitely. Yeah, because you will work with different type of customers with different needs, different emotional, needs as well. So you will definitely need patience to work, because it's you're working with people. You really need to have those people skills as well.
Definitely.
Yeah.
And I think it's really important, this slide, because if you're considering a career in social work, it comes with its own set of values. And it's good to check your values with that, because obviously if you're not a person, like a people person, and if your motives are very different in terms of life, in terms of what you want to achieve, you can have a clash of values. So whereas if you feel that this is something that you're passionate about, working with people, addressing inequalities, advocating for people's rights, it's your values line up with the social work values. So that's why I think it's very significant to talk about the values of the profession, so that is this really for me? Because it might not line up with the things that you see as important in life.
Yep.
So we've got 2 minutes, Mamta, and then we're going to reconvene back in the main room.
Yes, so it's just the last one: skills required in social work. So the core skills, there are many skills, but if we have to divide that, it's core skills are English, maths, digital skills, and employability skills. So English skills are, you should be able to read, write, speak, listen to the people. And why you will need those skills is because you will be communicating with people with different communication needs, maybe. So we don't expect you to know all the languages, but you should be able to communicate maybe via interpreter as well clearly, and you should be able to get what information you want from that person. And writing care plan, intervention plans, reports, and read and follow a risk assessment, maybe writing reports to the court as well, and report an incident or accident. So you have to be really documenting stuff you have observed or analyzed. Then you need to have number skills, because you need to do some calculations. You have to record numbers, understand measurements as well. If you are based in hospital, maybe you might have to understand some of the measurements and timetables and plan work. And similarly, digital skills, find and manage digital information, because these days most of the local authorities are paper free. Everything is recorded on the systems. So you should be able to interpret, read the data, gather the information, whatever is loaded on our recording systems. Yeah, and you might have to hand over cases, transfer cases to different local authorities or different people working with you. You should be able to share relevant information based on consent. So all these things you need to have. And definitely employability skills. If you want to work as a social worker, you should be a team player, problem solving, and plan your own learning and development. You need to plan your own career progression as well, and manage own health and well-being, because it could be challenging job, but you should put yourself as well important. Manage your own health and well-being, prioritize your own workload. This is how you will manage your health and well-being, and manage home and work-life balance, respond well to challenging behavior, and also adapt to changing demands at work. So these are the core skills you will need in this profession. Take your time, have a look and read it in your own time as well. I have put the link in the last slide as well. So yeah, these are the useful links. You can go to Skills for Care. It has very good page on careers in care, job roles in social work, and also careers in care, starting your career, how different options, and social worker values, or how to become a social worker, baswa.co.uk. Frontline Program, Think Ahead, and Step Up Social Worker. So all this information is in these links. And I think we're coming to the end of this session as well. So any question? Otherwise, we want you to. Thank you.